You're prepared to change your nursing specialization or embark on your chosen course, but how do you decide where to go? Or perhaps you know where you want to go, but you're unsure how to determine if it's the proper choice. So if you're confused, I'm going to give you some insight into various nursing specialties so that by the end of this video, you'll have a better idea of what specialty you'd like to pursue. Hey, I'm Isaac, the personal finance nurse, and my goal on this channel is to empower nurses feeling dissatisfied with their finances to take control of their budget, elevate their income, and ultimately lead satisfied and financially comfortable lives. It is safe to say that out of all the professions, nursing has been the most severely impacted over the past 3 years by COVID. Most nurses who had to work in a hospital or healthcare setting these last few years have had to deal with the big three: inadequate staffing, unsafe ratios, and inflation coupled with negligible increases in pay. Before the pandemic, there was already a nursing shortage, burnout, inadequate staffing ratios, and low retention among nurses. According to estimates, a whopping 5.9 million nurses were thought to be needed worldwide at the time. Now, if y'all thought this was a glamorous profession, think again. In 2020, a pandemic-related survey of 20,000 healthcare professionals at 124 institutions produced the following results. 63% of nurses experienced burnout, and 56% of nurses also mentioned work overload. Due to stress brought on by COVID, unreasonable workloads, and burnout, about 2 in 5 nurses wanted to quit their jobs altogether. One stat that jumped out about nursing retention, however, is the satisfaction of the nurse with their given specialty. Now, before we start looking at the different specialties, I want to guide you through a little questionnaire on your interests, personality, etc. First off, are you a people person? It's okay to accept that you don't always enjoy having direct contact with people, even if you care about them and have devoted your life to helping them. Numerous nursing specializations provide more solitary duties and quieter settings, making them ideal for introverts. Similarly, if you are so people-oriented that you want to not only engage with people, but also go as far as to manage a group of them, there is the appropriate specialty for you. Specialties for introverts include research-based positions or those requiring fewer patient interactions, like informatics specialists, forensic nurses, or private duty nurses. Extroverts should think about specializing in frontline nursing positions that need high levels of patient interaction, such as pediatric nursing, medical surgical nursing, critical care nursing, or travel nursing. Pretty much anything that requires you to be in front of a person. Now, are you one of those meticulous and methodical nurses who prefer slower-paced settings, the quick-witted and challenging-loving nurses who flourish in fast-paced environments, or are you somewhere in the middle? Pacing yourself while working equates to avoiding long-term injuries, minimizing strain, maximizing effectiveness, and maintaining the ability to work. There are certain complementary combinations to think about, even though attaining this will depend on your expertise and place of practice. If you prefer a slower pace, you might consider working as a home health nurse in patients' homes, an occupational health nurse at businesses and organizations that share your interests, or pursuing nursing research positions in schools and institutions. If you want a faster pace, action-loving nurses often judge facilities based on their trauma center status. Consider a career in critical care nursing at trauma centers, ER nursing in hospital emergency rooms, or nursing in none other than the OR. If you have a quick mind, a level head, and a desire for exciting work environment, this is perfect for you. Now, let's tell you about some fantastic in-demand nursing specialties. These specializations not only pay really well, but also suit everyone and might be the right choice for you. Travel nursing was regarded before the pandemic as a possibility for nurses who only seek a change of pace and environment. You could go to exotic locations, for example. At the height of the pandemic, though, this perception began to change. Travel nurses were hired for temporary positions in healthcare facilities due to staffing shortages and increased patient hospitalizations and admissions. Travel nurses' national pay increased by as much as 25% during the COVID spikes, earning between $500 and $10,000 extra per week. Due to increased demand, travel nurses were making twice or triple what staff nurses were. Contracts decreased as hospitalization rates stabilized. Nevertheless, due to ongoing staffing shortages and increased hospital admissions from new types, travel nurses will continue to be in demand. Another position you could consider is being an OR nurse. Patients are looked after before, during, and following surgery. Additionally, they might help during operations like C-sections, breast biopsies, or tonsillectomies. To meet the demand, 33% of operating room managers increased their workforce in 2018, according to the Association of Perioperative Registered Nurses, or AORN, which conducted the survey. The average pay for OR nurses is between $73,000 and $89,000 annually. Care for critically ill patients could be another specialty option for you. These nurses typically typically work in the emergency room or ICU. There's actually a growing demand for this specialty. In comparison to 2019, there was a 36% increase in ICU beds during the pandemic. The number of critically sick patients grew, which led to a rise in the need for critical care nurses. ICU nurses get a median pay of between $71,000 and $85,000 per year. A nephrology nurse or a dialysis nurse specializes in providing care for patients with renal issues. They frequently help patients receiving dialysis treatments and work in dialysis clinics or departments. Due to the aging population, this specialty is expected to experience positive job growth. Additionally, according to the 2021 Centers for Disease Control study, 1 in 7 US individuals had chronic kidney disease. The need for renal nurses is therefore anticipated to increase. The average pay for dialysis nurses is between $75,000 and $96,000. So by this point, I hope you have a better idea of how you'd like to specialize. Hey, if you like this content and want to learn more about the nursing profession and how to become financially satisfied while still working as a nurse, consider liking this video and subscribing to the channel. And hey, if you want daily personal finance tips, budget hacks, investing insight, and more, you can find me on Instagram or TikTok at isaaclee.rn. Anyways, I look forward to seeing you on the next video. Peace.